Our first guest today is Dr. Michael Peters with Coastal Carolina Ear, Nose, and Throat. Dr. Peters, thanks for joining us today.
Well, thanks for having me.
It's a pleasure to have you here. Now, I know that you're with Coastal Carolina ENT, and how long have you been with them?
I've been with them for 2 months now, a little over 2 months.
Well, little over 2 months. But I think you were here once before, is that correct? You were in the area and then you went off to do something else?
I was in Little River, North Myrtle Beach area in solo practice for 6 years. I left for a couple years for some family reasons, and we had such a good life down here, we decided to come back and live here again and resume my practice with Coastal Carolina ENT.
That's a great practice. I know of it personally, and I think they do a great, great job. So let's talk a little bit about you. Introduce yourself to the community and tell us a little bit about your education, your background.
Okay. Well, I finished my bachelor's degree when I was in the service, and as soon as I was discharged, I started medical school, and I did medical school in Brooklyn, SUNY downstate in Brooklyn. So I often say I went from one war zone to another. So while I was there, I was able to do a visiting rotation at the University of Minnesota in otolaryngology head and neck surgery, and was lucky enough to get into that residency program. So I did my residency there. And after my residency, I decided to, well, I didn't decide, they chose me to stay there for my facial plastic and reconstructive surgery fellowship. So I was really fortunate to get into that program there.
Wow, quite a background. That's a very impressive educational background.
Thank you.
So now I heard you say you were in the service, you were in the Navy, is that correct?
Yes.
And how was that for you? Did you enjoy the service? And
it straightened me out.
well, that's one way of putting it.
It was good. I was a hospital corpsman, which is the Navy and Marines form of a medic.
Okay.
And I served on both coasts, and both with the Navy and the Marines, and was honored to serve with the 1st Marines and Fleet Hospital 5 with the ground troops over in the First Gulf War. So it served me well. I probably would have stayed in, but after the Gulf War and having family, I felt I should probably get out and do what I wanted to do. So I miss it to some degree. But.
Wow, that's real interesting. I was happy to learn more about your naval career. So let's talk a little bit about your practice. Where are you located?
Well, my primary location, actually the location I only see patients now, is in Little River, just over the border into South Carolina. We have other offices in Charlotte and an office in Whiteville where my partners go.
And do you have privileges at one of the local hospitals?
I do all of my inpatient procedures at Brunswick Novant Hospital. And I'll do some other outpatient procedures for locals down in a surgery center in South Carolina, but I probably do half of my procedures at Novant Brunswick.
Great, great. We're really pleased to have you here in the area. I think you bring a wealth of experience to this area.
Well, thanks. I've been impressed with the hospital and the operating rooms, and I'm looking forward to bringing more cases there, actually.
Great, great. Well, now we've had Dr. Corey on the show in the past from Coastal Carolina ENT, but I think you have a couple of other partners, and do you want to share those with us?
Sure. Dr. Kenyon, he's the partner who started the practice years ago, and Dr. DeMuzio. They're the other two that cover the 2 offices in North Carolina.
That practice has grown. It's up to 4 physicians now, so it's really grown a lot. Some folks are not familiar with what an ENT doctor does or is, so do you want to talk a little bit about that for our viewers?
Sure. It's the most difficult specialty to pronounce. Otolaryngology head and neck surgery is the formal terminology, but basically we treat diseases of the ears, the nose, the throat, pretty much everything above the neck, not including the brain, the spine, and the eyeballs themselves. And it's a pretty broad spectrum set of disorders we treat.
Right.
It can be anything from as simple as giving medications to doing surgery with microscopes and removing cancer and reconstruction and trauma. So it's a fairly extensive field of diseases that we treat.
Now, I know you did a fellowship in plastic surgery.
In facial plastic and reconstructive surgery.
Let's talk a little bit about that.
Sure.
What kinds of procedures might that entail?
Okay, well, the training initially was pretty well broad spectrum facial reconstructive.
Would that be like after
treatment.
an accident?
It was
something like
after an accident, trauma, skin cancer reconstruction,
Oh.
head and neck cancer reconstruction,
Oh, yeah.
cleft lip, cleft palate repair in children,
that? Okay.
trauma, cosmetic surgery.
So you do cosmetic surgery?
I do, yes.
Uh-huh.
And that's probably about 30% of the reconstructive work I do. Most of the reconstructive work for medical problems or for diseases usually requires that we remove something bad,
Yes.
and then we want to fix things so that they work well and look good. So that kind of feeds into the cosmetic part as well. So, you know, I like doing the cosmetic part. It helps keep my skills up for the reconstructive
True.
part, but the reconstructive aspect for diseases is more rewarding.
I'm sure. Especially, I know you see children, is that correct?
I do.
And you do cleft and palate reconstruction?
It's a little bit harder to do now in the private sector. You really need a more concentrated team.
I see.
I'll do some revisions and treat some secondary cleft palate and cleft lip work, but I've left that work to the larger universities where the children can be taken care of with a more comprehensive team.
Yeah. Now, the procedures that you were speaking about, are those mostly inpatient or outpatient procedures?
Outpatient. The majority of the skin cancer work I do can be done right in my office.
Oh, that's great.
It saves time, saves
What's
money.
cost saving?
Cost
Yes.
savings. For people who aren't comfortable doing it in the
Sure.
office, we can do it in the hospital or outpatient
Yeah, they don't want to
surgery
know what's
setting.
going on.
Exactly. So rarely, if ever, does anybody have to spend more than a night in the hospital. But I'd say better than 95% of the patients are going home the same day.
Is there a common procedure that you do most often? I'm just curious. What do you do the most of?
As far as reconstructive work, the three probably most common reconstructive procedures are skin cancer removal and repair.
Yes.
The second is nasal reconstruction. And the
Like
third,
I had a broken nose, and I have this deviated septum thing. Like I can't breathe out here, and you could fix something like that.
right, that part, or even more complicated things where people have been operated on before and they need revision work. So that tends to be my area of specialization, nasal reconstructive work. And then thirdly, eyelid reconstruction for vision, for the upper eyelids if the eyelids are drooping, or for the lower eyelids if they're drooping and they cause infections and irritation of the eye and the eyeball. So those are the three most common areas that I treat.
And then in terms of cosmetic surgery, what would be your most common?
Probably rhinoplasty, the nasal reconstruction, or nose job.
Nose job.
And,
I was thinking it was going to be eyeballs,
Oh,
eyelids.
eyelids are right there with it. I've probably done as many as both, as many eyelid reconstructions as nasal reconstructions. And then I'm very selective in the facelift skin tightening procedures. Those are big procedures, and I like people to get good results, excellent results. So I'm very selective in when and if I'll do those.
So are you currently accepting new patients?
Always.
Good. And how might we contact you if we'd like to schedule an appointment? Do you need a referral or anything like that?
No referrals are necessary. Referrals are typically needed only if the insurance companies require that a patient needs a referral. Either the patient's family doctor can call and schedule with us, or they can call directly, or any of our offices. But for me directly, we have a phone number for our office in South Carolina.
I'm so glad you were here today and let us get to know you a little better and let our viewers get to know you. So I hope you'll come back and visit us again sometime, and we'll talk about something different.
Well, it's been a pleasure, my pleasure.
Well, thank you again.
Thank you.